The World Health Organization panel on this theme says more studies should be conducted to ascertain the different possibilities and the origins of the pandemic. This is our focus today on sound. The conversation begins after this break. Please stay tuned. It is still Sound Health on Lagos Television. Joining us via Zoom this afternoon from Oye-Ekiti is Dr. Stephen Ojo, a medical microbiologist with the Department of Microbiology, Federal University, Oye-Ekiti in Ekiti State. Good afternoon and thanks for joining us, Dr. Ojo.
Thank you, Modupe, for having me with you.
All right, I'm sure you've been following trends on the origin of COVID-19. The latest report by the World Health Organization new panel says more studies should be conducted to ascertain the different possibilities of the origin. What are your thoughts on this development?
Yes, according to WHO, they have a collaboration with various institutions, research centers, and also at least individuals who are into research and universities on at least identifying those the pathogens, especially the new variants, the variants of concerns now, and also linking them up with the other variants, which are now tagged as previously variants of concerns. That's the Delta variant, the Alpha and the Beta and the Gamma variant. So there is an extensive studies, and that's why researchers, institutions all over the world are also keen into it, and we expect NCDC in Nigeria and also research institutions in Nigeria to also at least play a key role into identifying these origin of these pathogens, which are of interest for us now, of concerns.
Okay, do you actually feel there's every possibility that there was actually a leak from the lab? Because according to this recent report, it says it is quite underwhelming, and they are still not sure if this report is inconclusive.
Yes, before now, the belief was that the virus was generated from research in the lab in China, and even though they also still associate it with animals, it was from some animals like that, and that's why it is now very important for WHO to be able to establish that fact, so that it will also help in curtailing the transmissibility of this pathogen, either animal to animal transmission or animal to human transmission, as the case may be. So there is a great need for a versatile and a thorough research into this, so that at least the global world will be at least will know, or will be at least brought to the knowing of this of the origin of this pathogen.
Okay, one of the recommendations by the Scientific Advisory Group for the Origins of Novel Pathogens says closely examining environmental samples taken from the market and doing investigations as well as audits is recommended, is a must. Do you think the Chinese authorities are ready to, cooperate with this panel? Because this has
The
always been
Chinese
the
government have
trend.
actually been making things difficult for researchers, because even before now, there were some studies which have been published showing that this COVID-19 virus, the SARS-CoV-2, were isolated from environmental samples, even from kitchen wastewater like that. And so there is a need for more studies into that. And one will expect the Chinese government to be able to at least cooperate with the international organization, especially the international body, the GISAID, that are responsible for this collaborative research, so that at least we can nail the transmission and the origin at the board to exactly know. But I think with the way the Chinese government are playing, it's as if probably there is something they are trying to hide, because there was a time report also showed that there was a researcher from China who was trying to also unveil how this pathogen, this SARS-CoV-2, emanated, but the whole thing was killed. And till date, there is no known, at least no known fact about the origin. But I think Chinese government, at least if they will not, WHO should be able to mete out probably sanctions through the United Nations on at least on addressing this issue, because it is a global pandemic. It's no longer within their jurisdiction alone, and it has crossed over to about over 100 countries now that are being affected. Until date, there are still the incidents of increase, even though there are decline, but at least there are still high fatality rates that are still being recorded till date across the countries that are still being affected.
All right, you actually took the questions out of my mouth. I was about to ask you, should there be sanctions? What should the World Health Organization and the global body do, in this regard? We keep going on and on about the origins. Should there be sanctions if this country is not willing to play ball with the necessary committee?
Yes, like I said, because this whole episode started in December 2019, and even though it was by January 2020 that most other countries now begin to get to it, and this is 2022, June 2022. Until date, WHO has not been able to come up with a concrete evidence of the origin of this pandemic, of this SARS-CoV-2, which is critically affecting lives. It has killed so many economy. It has actually affected so many lives, so many homes. Loved ones have been lost into this pandemic, and it behoves on WHO and United Nations to actually come up with a full force sanctions on the Chinese government to make sure they cooperate effectively with the international bodies that are in charge of this collaborative research, so that at least if there is any other thing based on epidemiological studies that countries should be able to at least get themselves prepared for, in order to avert any resurgence, because WHO is also proposing that there could be a further resurgence of this, even those ones they've had previously, variants of concerns like the Delta variant, Alpha, Beta, and Gamma. So if they are resurging again, how do other countries, especially the African countries that are not even well equipped, whose medical facilities, hospitals are not well equipped like that, what becomes of them? You even presently, you notice that the high rise is still within the US, having more confirmed cases and more fatalities, followed by even China itself, followed by Germany, Brazil,
India,
Germany, and the like. And fatalities, even to, if we're still having this rise in confirmed cases, and till date, there is nothing being done by WHO and United Nations, then that means the whole world should hold them responsible to the life that have been lost, to the economy that have been affected, and to homes that have been shattered. So I think there should be proper sanctions now, because it's over 2 years that we've been in this struggle to identify the origin and to know how to, because if you cannot identify the origin, there is no way you can begin to talk about the epidemiologic studies, the transmissibility, the severity, and the like, even though there are still studies going on partly along the line. But the origin is actually very important, because in global health studies, in public health studies, you need to know the origin. And that is when it will be able to at least inform those within the public health sectors and also the community to know what the measures they are supposed to take to avert further occurrence of such disease.
All right, some school of thought are of the opinion that we should just move ahead with things. We should move ahead with our business rather than going back and forth about the pandemic, especially focusing on accusations and counter accusations. Do you share the same thought?
At all. There's no way we can just move on and neglect, like I said earlier, this is of public interest and it is global. If probably it's just within a part of the continent, it's just within a region, that is when you can say, okay, you want to probably overlook it. But even at that, there's no way you can overlook it, because there are people that are traveling from one part of the country to another, and they are also being exposed to such like that. Even as at today, WHO by their recent report, that's June 8th, they were still studying on the booster vaccines. That's to check the effectiveness of the vaccines and to see whether, because studies shows that, okay, for 3 months period, they were effective. Some of these vaccines, about 5 of them were effective, but it began also to reduce. For those who are symptomatic patients, there was a reduction as compared to those that had severe diseases. So those who are just carrying the symptoms, then what happens to them? So even the booster vaccinations, WHO is still researching on it, and they want to see if they can of any disease is very, very paramount in public health. And there is no way you can just push it aside, because it concerns you, it concerns me, it concerns everybody. So long as people are traveling from one place to the other, and then they are also still being exposed to this unknown origin, which we don't know about. Is it through air? Is it through animals? Is it just of biological weapons? And these are things we should know, so that at least every country will know how to set up own local context measures to this problem. So I think there is a need for, I don't subscribe to, we just let him go. WHO should still insist on a pragmatic resolution to it.
Okay, I know this is part of preparedness for future pandemics and all that. What measures should be put in place by countries in terms of, preventing future epidemics?
Yes, countries should be able to, one, vaccination. The vaccination program should be looked into to make sure it's very effective. They should still disseminate information about vaccination, the essence of vaccination, either for those who are asymptomatic or for those who are symptomatic or those who have severe diseases or those who are underlying comorbidities, like those with maybe cardiovascular problems, those with diabetes and some other things like that. So there is a need for countries across the globe to look at their vaccination strategy to make sure that it is all-encompassing and it is going not only within the city like that, it is also being disseminated to the local levels. For example, in Nigeria, at least, the basic primary health should also be well equipped to move from house to house, church to church, mosque to mosque, to traditional homes, to everywhere, to schools like that, even to centers, event centers like that, where people gather. And two, another measure should be our social measures and public health measures like that. The social measures in terms of maybe social physical distancing, effective hands washing, at least returning from anywhere you go to, tell you're coming back home, there should be such. So I think even the radio stations, TV stations like that should also assist in this, in education, just like we are doing in educating the public over it. And there should also be the health facilities, the hospitals now should be well equipped and should be well prepared like that for further reoccurrence of this. Even for those who are still hostel dates, there are still reports, there are still cases like that. So the hospital should also be better equipped for this. And probably more centers created, more centers are not created, because if there is any case, any suspected case, the first point of call is in the hospital, the general hospitals. And that means where either the tertiary or the secondary hospitals like that. So at such points like that, the hospital should be well equipped so that there should be proper diagnostic measures, so that anybody coming in that is having hospital should be equipped, because they are the first point of call to any suspected cases or any suspected case like that. So the medical personnel should be well equipped, should be well trained. There should be diagnostic facilities for them, so that at least anybody presenting himself or herself at any of these hospitals, either basic primary center, the tertiary hospitals, there should be these diagnostic tools that will quickly identify or diagnose the patient critically, and to know whether they are to move them to the isolation centers. Because if the hospitals are not well equipped, then there will also be a widespread within the hospital and from the hospital to the community. So I also said about engaging the business places, event centers, organizations, to make sure that their public health measures or probably their social measures are also adequate like that. So we should not still lose that of our normal hand washing practice, which was brought up during this COVID-19, like that. Physical distancing should also still be enforced. So all those social measures should still be on. The use of nose mask, we should still be engaged in it. So there should still be a continuous engagement by every government at the federal, state, and local level to make sure this SARS-CoV-2 or the COVID-19 rested to the barest minimum.
All right, hopefully we will conquer the pandemic. I hope the findings one day will become conclusive so that we can beat the pandemic. Dr. Stephen Ojo, thank you so much for your time and expertise on the program. We really appreciate you.
Thank you for having me. Thanks.
Yes, I have been speaking with Dr. Stephen Ojo, a medical microbiologist with the Department of Microbiology, Federal University, Oye-Ekiti State, on the latest reports on the origins of COVID-19. Hopefully, the findings will become conclusive someday, and hopefully, getting the origins will bring about ending the pandemic. It is still Sound Health on Lagos Television. The program continues with trending health reports. Please stay tuned. right, this is where we say thank you on today's episode of Sound Health. Remember, just because there is limited attention directed towards COVID-19 does not mean it has ended. The pandemic is still there. Protect yourself and your loved ones. Wear your mask. Wash your hands with soap and water or alcohol-based hand sanitizer. You also need to avoid large gatherings. Get vaccinated. The vaccines are safe, free, and harmless. Join me again next week for another edition. But before then, for comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.